As you know, Singapore experienced SARS in 2003, and since that time, we have been working in earnest to prepare for a flu pandemic that may happen to us. And we began drawing on lessons that we learned from SARS, and we now have a better understanding of the issue. We have set up a home-front crisis management system to deal with major crises like this. And I chair the Home-Front Crisis Ministerial Committee. That is also a committee chaired by the PEMSECs, comprising officials from practically all ministries in the government. And through these years, since 2004, we have put in place many plans, and we have tested the plans, and we have practiced various scenarios, just to make sure that we are ready to respond to any crisis such as this kind of transmission of Mexican swine flu. We are treating this outbreak not just as a medical problem. We have to deal with it as a total problem that require both medical and non-medical intervention. We have medical response plans and non-medical response plans. We also need to have population response plans, particularly in regard to making sure that we can continue with our essential services. Otherwise, we will be ground to a halt. By the nature of flu virus, I don't think we can confine the Mexican swine flu to isolated clusters like SARS, where we can immediately find the people, quarantine them, and then separate them from the community. Particularly when the transmission has become very effective, and there's a human-to-human transmission that spreads very fast. But we can take some precautions at a personal level in particular. Personal hygiene is very important. So practicing good personal hygiene, washing hands, seeing the doctor immediately when one doesn't feel well, and then listening to the doctor's advice, wearing masks if you feel that we want to cough or having flu symptoms, we can probably minimize the transmission of the virus in the general population. So an important part of it is really the population, to be able to take precautions and not to pass on the flu that they have with the people whom they come into contact with. We will, as a government, also keep our people informed from time to time and when necessary on the latest situation, and to let them know what we are doing and tell them as much as we can. Our ability to respond effectively to any severe pandemic will certainly depend on the extent in which we can get cooperation from not just the people, but also the public and private sectors, particularly the employers and the companies, and more so among the essential services. For businesses that are essential to our survival, we must make sure that they have business continuity plans in case some of the staff get infected. In other words, they have to have people on standby, ready to take over, and take the necessary measures to ensure that they do not cross-infect one another. We do that for the government. We have done that for the ministries, and we have standby teams ready to take over. We've got a standby operation centers just in case. And we have been exercising in many areas, in particular in schools, for example. We have got our school children getting used to taking the temperature. When we have hand-foot-and-mouth disease outbreak in kindergartens or childcare centers, and one of the things they do is to clean up the place and take temperature and take the necessary precautions. As you heard Dr. James just now, there is currently no case of Mexican swine flu in Singapore. So we haven't got a case in our community yet. But nonetheless, in the last week or so, we have primed all our medical practitioners to be ready to watch out, to monitor, and to report cases which they think may be symptomatic of flu virus like the Mexican swine flu. We have also taken many measures in the hospital level to raise our guard against any possible transmission, just in case. So disease surveillance is very important, not just locally, but also to know what's going on in other countries. The top priority in our plan is to make sure that we can respond via medical responses, and therefore, as we have been briefed earlier on by Dr. James, we have seen that many measures are already in place. We have also put in other measures. Those who come in from the airport will know that a few days ago, we have set up temperature screening at our airport. We'll be also deploying similar thermal scanners at our ferry checkpoint. And for some years now, since the last experience we had, we have been stockpiling Tamiflu. So we have more than 1 million doses of Tamiflu available to deal and to treat our patients. I want to emphasize here that the government is taking this very seriously, and we are deploying all resources across the government to manage this disease should it come to Singapore. And our responses so far, I would say, have been quite swift and quite comprehensive in light of the experiences and the lessons we draw from SARS. So at this point, all of us should be alert, but should not be unduly alarmed by what is happening, but just be alert and be cautious and be vigilant. We are better prepared today than when we were in February, March, April 2003. So having been through that myself and having chaired the committee too, I know that at least we have done something more than what we used to know. So let me emphasize again, everyone must take precaution, and only then can we hopefully minimize the transmission of the virus among the community. But with any human flu pandemic, there are many unknowns. We cannot anticipate all kinds of situations, but we have to find ways of dealing with them when we are confronted by them and try to anticipate as much as we can. Despite all the measures we have taken, I want to emphasize that we must not be complacent that the virus will not come to Singapore. We are a very open society. Many people come to Singapore. Many Singaporeans travel overseas and they come back home. And with transmission being so efficient among humans, it is possible that we can get hit by the Mexican swine flu. And when that happens, we must face up to it and deal with it. And as a community and as a people, we will have to learn how to adjust. So I stop here and ask Mr. Corbin to say something, because he's also actively involved in dealing with this.